Operating Room 1 at St. Jude's Grand Hospital hummed with the sterile tension of controlled chaos. Elara Vance, new surgical nurse, felt every vibration in her chest. Her plain scrubs and tied-back hair made her practically invisible against the pristine white walls, just as her quiet demeanor ensured she was often overlooked. Dr. Aris Thorne, a figure of imposing arrogance, barked an order, not even glancing her way as she precisely handed him the requested instrument. She flinched internally, a familiar wave of nervousness washing over her as a senior nurse shot her a patronizing look. Elara was merely an assistant here, a rookie, her presence tolerated, not valued. Suddenly, the monitors blared, a heart rate plummeting, an unexpected hemorrhage blooming on the screen. Panic rippled through the elite team. Dr. Thorne's brow furrowed, his usual confidence cracking, a rare moment of vulnerability exposing the true gravity of the situation. Elara's breath hitched. In the ensuing scramble, a critical instrument clattered from a shaky hand, bouncing under the sterile field. Every eye turned to the floor, confusion and growing fear seizing the room. But Elara, unnoticed, had already registered the exact location, her eyes locked on the precise point, her mind already calculating, her quiet hands poised. They saw a timid girl, they had no idea what she was truly capable of. The air in or one, usually a symphony of controlled precision, fractured into a jarring dissonance. The dropped instrument, a vital clamp, had been the linchpin of the delicate procedure, and its absence now resonated like a missed heartbeat. Panic, a raw, unwelcome intruder, rippled through the room. What in the blazes was that? A voice boomed, sharp as a scalpel's edge. Dr. Aris Thorne, the renowned lead surgeon, burst through the scrub room doors, his handsome features already etched with impatience, his eyes, usually alight with self-assurance, now narrowed to slits of irritation. He had been briefly reviewing a complex scan, leaving the initial incision to his primary resident, but the sudden commotion had pulled him back. He moved with an almost aggressive confidence, a man accustomed to deference, his presence immediately dominating the already tense space. "Sir, the laparoscopic clamp," stammered Dr. Chen, the resident, his face paling under his surgical mask. It slipped. Under the field. Thorne strode to the table, his gaze sweeping over the sterile drapes, dismissing the resident with a flick of his wrist. He was a maestro, and this was his orchestra. Any sour note was a personal affront. His eyes, however, did not miss the slight tremor in Nurse Miller's hands, the senior scrub nurse, nor the palpable fear emanating from the younger staff. He merely absorbed it, like a king observing the failings of his subjects. Elara, who had registered the precise arc and final resting place of the clamp with an almost preternatural awareness, felt a familiar tremor begin in her own hands, though it was born not of fear, but of suppressed impulse. Her eyes remained fixed on the invisible point beneath the table, her mind already mapping the angles, the reach, the retrieval. She saw the chaotic energy of the room, the frantic, undirected glances, the mounting anxiety that threatened to consume their focus. It was inefficient. Dangerous. "Retrieve it!" Thorne barked, his voice cutting through the rising murmur. "Now! We are losing time. Patient's vitals are stabilizing but tenuous." He glanced at the monitor, a flicker of genuine concern momentarily eclipsing his usual hauteur. The patient, a prominent philanthropist, was already compromised. A junior nurse, barely out of training, fumbled with a pair of long retrieval forceps, extending them blindly under the drapes. Her movements were hesitant, uncertain. I can't quite reach it, Dr. Thorne," she whispered, her voice barely audible. "For heaven's sake, Nurse Albright. Are your eyes painted on?" Thorne snapped, snatching the forceps from her. He leaned over, his brow furrowed in concentration, but his movements were less precise, more forceful than the delicate situation required. He probed, nudged, then pulled back with a frustrated sigh. "It's wedged. Damn it." Nurse Miller, a woman whose calm usually radiated through the aura, now looked genuinely flustered. "Dr. Thorne, perhaps we should attempt to shift the table slightly?" "Shift the table?" Thorne's laugh was humorless. "And risk compromising the field further? Are you quite mad, Nurse Miller? Just get another clamp." We must have a spare. We do, sir, but it's the specific articulating clamp required for this vascular repair, Miller explained, her voice tight. The spares are standard, not articulated. It would slow us down significantly to adapt, and frankly, it's not ideal for the precision required here. A heavy silence descended, thick with the unsaid understanding of the severity. Time was not merely ticking, it was hemorrhaging. The patient's blood pressure was now a slow, downward crawl. Elara's breath hitched again. She knew where it was. She knew how to get it. Her gaze flickered to the clock, then to the pale, still form beneath the drapes. Her hands, calloused from years of discreet, self-taught practice, itched with a desperate need to act. "Excuse me, Dr. Thorne," Elara began, her voice a reedy whisper, barely audible above the muffled beeps of the cardiac monitor. She hated drawing attention to herself, her cheeks already flushing a deep crimson under her mask, but the patient's rapidly deteriorating condition was overriding her ingrained humility. "I believe it's lodged." She gestured vaguely towards the lower left quadrant of the table base, just past the fourth caster, tucked between the power conduit and the pneumatic line. A slight twist of the long arm retrieval and it should pop free. Thorne slowly turned, his eyes, usually so quick to assess, now settling on Elara with an expression of utter disbelief. "And who, pray tell, are you, nurse?" he asked, his voice dripping with condescension. He squinted, trying to place her. "Ah, Vance. The new surgical scrub. Just arrived this week from, where was it? Rural clinic, wasn't it?" He paused, allowing his disdain to hang in the air. "I appreciate your enthusiasm, Nurse Vance, but perhaps you should leave the high-stakes retrieval strategies to those with a bit more operating room experience than a week at St. Jude's." He waved a dismissive hand, as if swatting away a fly. "Focus on keeping your instruments organized. That would be a significant contribution." A ripple of barely suppressed snickers spread among the other nurses. Even Nurse Miller gave Elara a sympathetic, but firm, shake of her head. "Don't bother, dear. He won't listen, *. Elara felt the familiar prick of shame, the burning humiliation that always accompanied her attempts to step outside her assigned, insignificant role. Her cheeks burned hotter. She looked down, her shoulders slumping just perceptibly, confirming their silent judgment, just a timid rookie. But internally, a stubborn, unyielding ember glowed. She knew she was right. "Someone get me the standard clamp," Thorne roared, abandoning the retrieval. "We'll make it work. Nurse Miller, prepare for manual retraction. Dr. Chen, get ready to apply countertraction. We're going to have to work around this." The atmosphere, already charged, crackled with renewed urgency, but it was a chaotic, disorganized energy. Nurses scrambled, fetching the standard clamp, but the shift was a clear downgrade, a compromise born of desperation and Thorne's refusal to admit a mistake or listen to an inferior. "Nurse Vance," Thorne added, without even looking at her, his voice clipped and dismissive, "you may assist Nurse Albright in clearing the discarded drapes and preparing the next set of instruments. Perhaps practice your draping technique. That's a skill you can master without causing undue distraction." It was a cutting remark, intended to sideline her, to put her firmly in her place at the bottom of the hierarchy. It implied she was not only inexperienced but also an irritant, a nuisance. Elara felt her face drain of color, replaced by a cold knot in her stomach. Her hands, which moments ago had yearned to retrieve the clamp, now felt heavy, useless. She swallowed hard, her eyes still darting to the monitor, where the patient's vitals continued their slow, alarming descent. The standard clamp was now being prepared, but she knew, with an intuitive certainty, it wasn't the right tool for the job. Not with the time they had. Not with the level of precision required. She was an irrelevant cog, a background shadow, her knowledge and capability utterly invisible to the prestigious team around her. The Grand Temple of Medicine had no room for quiet competence if it came from the wrong mouth, the wrong status. Elara moved mechanically towards the instrument trolley, her assigned task a hollow mockery of the life-and-death struggle unfolding before her. Humiliation was a bitter taste in her mouth, but it was slowly, steadily, transforming into something else, a simmering, quiet defiance. The patient's life hung by a thread, and they were choosing ignorance over instinct, ego over efficiency. It was unacceptable. The metallic tang of anticipation and antiseptic hung heavy in the air of War I, a scent that usually sharpened Elara's focus, but now merely underscored her powerlessness. Her fingers, usually so precise, trembled almost imperceptibly as she rearranged a clamp on the instrument trolley, her gaze fixed on the sterile field. Dr. Thorne, a blur of confident motion, barked orders, his voice reverberating off the polished steel and glass. But Elara saw past the bravado, past the flawless technique he presented to the world. She saw the subtle tremor in his left hand, the fractional hesitation before a crucial incision, the way his brow furrowed just a degree too deeply. He was good, yes, but he was human, and his ego was a blinding spotlight, casting shadows where he needed clarity. The patient, Mrs. Albright, a fragile woman undergoing a complex aortic repair, was deteriorating. Elara's internal clock, honed by countless hours of studying anatomical atlases and practicing impossible sutures on delicate fruit skins in her solitary evenings, screamed in alarm. The arterial pressure had dipped, not a sharp, sudden drop, but a creeping, insidious decline that suggested something more subtle, more dangerous, than a simple anesthetic adjustment. Nurse Vance, Dr. Thorne's voice, laced with mild irritation, cut through her thoughts. Are those retractors ready? We're losing time. Yes, doctor, Elara murmured, her voice barely a whisper. She pushed the trolley closer, offering the requested instruments with practiced efficiency. Her eyes, however, darted to the monitor displaying the patient's vitals. The heart rate was escalating, a compensatory gasp for the falling pressure. She knew what this meant. Quietly, almost imperceptibly, she cleared her throat. Doctor, she began, her gaze still on the pulsing red line on the screen. The central venous pressure seems unusually low, given the volume administered. Dr. Thorne paused, his hands hovering over the surgical site. A ripple of strained silence spread through the OR. He turned his head slowly, his eyes, usually piercing, now narrowed in thinly veiled annoyance. Nurse Vance, is there a problem with the instruments? No, doctor, but I believe. Then your focus should be on my needs, not interpreting the anesthetic readings. His tone was sharp, dismissive. Leave the diagnostics to Dr. Chen. He gestured towards the anesthesiologist, Dr. Chen, a weary-looking man who merely offered Elara a sympathetic, helpless shrug. It was a clear, public rebuke, a reassertion of the rigid hierarchy. Elara felt a blush creep up her neck, her hands tightening their grip on the trolley. She had dared to speak out of turn, to overstep her rank. The humiliation was a hot ember in her chest, slowly hardening into quiet conviction. Minutes later, the alarms began to wail. A sharp, insistent shriek that sliced through the controlled calm of the operating room. Mrs. Albright's blood pressure plummeted, dropping faster than a stone in a well, and her heart rate spiked frantically, a desperate drumbeat against the silence of impending death. What in God's name? Thorne roared, his composure shattering. Chen. What's happening? Dr. Chen, already frantically adjusting drips and checking readouts, looked up, his face pale. Massive hemorrhage, Aris. But I don't see an obvious source here, everything looks tight. The words, massive hemorrhage, echoed like a death knell. Panic began to ripple through the team. The scrub nurse next to Elara gasped, her hands faltering. Elara, however, felt a strange clarity descend. The nervousness that usually clung to her like a second skin evaporated, replaced by an icy calm. Her mind raced, sifting through every anatomical detail, every surgical complication she had meticulously memorized. Retractors, wider. Suction, now. Thorne's voice was hoarse, desperation creeping in. He plunged his hands back into the incision, probing frantically. Blood welled up, obscuring his view, making it impossible to identify the source. The monitors continued their relentless, terrifying protest. We need more visibility, Doctor, another senior surgeon, Dr. Ramirez, interjected, his voice strained. The bleed is too diffuse. It's not diffuse. Thorne snarled, sweat beading on his forehead. It's hiding. There's no obvious rupture point. He ripped off his surgical mask, revealing a face contorted in frustration and growing fear. This wasn't the Dr. Thorne who strolled through the hospital with an air of unassailable genius. This was a man facing the limits of his expertise, and he didn't like it. Elara's gaze was glued to the monitors, then to the precise movements of Thorne's struggling hands. She saw it. She understood. It wasn't a conventional bleed, not a simple arterial rupture. It was something far more insidious, a silent killer often overlooked until it was too late. A dissection, a tiny, almost invisible tear in the wall of a vessel, allowing blood to seep into the layers, expanding outwards, causing pressure drops without an obvious gush. The low CVP she'd noted earlier, the creeping decline, it all made terrifying sense. The initial problem wasn't a sudden burst, but a structural failure, exacerbated by the very manipulations of the surgery itself. She instinctively reached for a specialized fine-gauge needle, one used for delicate vascular repairs, but hesitated. How could she, the nervous, quiet rookie, interrupt the great Dr. Thorne now? His earlier humiliation of her had been a public performance. This would be an unforgivable offense, possibly career-ending. Her hands, however, were steady, the needle perfectly balanced in her fingers. The patient's life, Mrs. Albright's life, was slipping away. "We're losing her, Aris," Dr. Chen cried, his voice laced with despair. "Her pressure is unrecordable. I can't hold her much longer." Thorne looked up, his eyes wild, sweeping across the faces of his team, finding no answers, only shared panic. "Where is it? Where's the damn bleed?" He was frantic now, his hands becoming less precise, more desperate. He was searching for a gushing torrent, but Elara knew it was a weeping secret. This is impossible," Dr. Ramirez muttered, shaking his head. "We've got full exposure, but no source. It's like the blood is just vanishing." His eyes briefly met Elara's, a flicker of bewildered desperation. Thorne slammed a gloved fist onto the instrument tray, the sound echoing ominously. "It can't be impossible. She's right here. A human being. We can't just stand by." He looked around the room, his eyes finally, fleetingly, landing on Elara, who stood frozen, the fine-gauge needle still clutched in her hand. He didn't see her, not really. He saw another nurse, another pair of eyes witnessing his failure. His gaze swept back to the field, despair etching itself deeper onto his features. No visible source. Pressure crashing. It's a diffuse, intractable microbleed, or a major vessel dissection that we simply cannot locate. The tissue is too friable, the visibility too poor. We can't find it. We can't stop it. His voice was low, defeated, a stark contrast to his earlier bluster. "We've exhausted every conventional approach. I don't know what else to do." He lifted his hands from the patient, a gesture of surrender. "This is an impossible challenge." The words hung in the air, heavy, suffocating. An impossible challenge. A death sentence for Mrs. Albright, delivered by the very hands meant to save her. And Elara, who saw the answer with a terrifying clarity, was just a quiet nurse, relegated to the sidelines, her voice silenced, her talent unseen, unacknowledged. "All right, quick break. You're invested in seeing how this story's central theme truly unfolds, right? Don't miss the next part. Keep unraveling these truths with us. Hit that subscribe button now. Your support keeps these adventures coming." The air in operating room 1 became a tomb. Dr. Thorne's declaration echoed, chilling, leaving behind a silence so profound it felt like the very heartbeat of St. Jude's Grand Hospital had faltered. Mrs. Albright, pale and fragile beneath the sterile drapes, lay suspended between life and oblivion. Elara's own heart hammered against her ribs, a frantic drumbeat of desperation. She saw it. A thread, a minuscule possibility, an anatomical anomaly that only an eye trained by years of obsessive study, not just textbooks, could discern. A forgotten collateral pathway, a rerouting that, if meticulously navigated, could provide the crucial diversion of blood flow and allow for the repair. It was a theoretical solution, one that defied conventional surgical wisdom, but it was there. And it was the only one. Her gaze flitted from the monitor, now screaming its silent protest with rapidly plummeting vitals, to Thorne's defeated back. He stood slumped, instruments forgotten in his gloved hands, a Titan brought low. The other senior staff, Dr. Reyes, the anesthesiologist Dr. Chen, and even Nurse Brenda, whose patronizing smiles usually accompanied her instructions to Elara, all wore expressions of grim resignation. Despair was a contagion. Dr. Thorne, Elara's voice was barely a whisper, a tremor of fear threading through it. It was a breach of protocol, an unthinkable impertinence. All eyes snapped to her, a sudden, unwelcome spotlight. Thorne turned slowly, his face etched with exhaustion and frustration. Nurse Vance? Now is not the time for reflections. His tone was sharp, a whipcrack of dismissal. Sir, Elara pressed on, her internal terror battling her absolute conviction. There might be a different approach. A collateral vessel, proximal to the aneurysm, branching off the subclavian. If we can isolate and redirect flow through it, even temporarily, it could allow for the repair of the main artery. A beat of stunned silence. Then, a mirthless laugh from Nurse Brenda. Nurse Vance, you're suggesting we reroute flow through a hypothetical vessel that no one else has ever identified? And a patient whose anatomy is already proving impossible? Her voice dripped with condescension. Dr. Reyes shook his head. Elara, we've explored every known pathway. The risk of further hemorrhage attempting to find something that doesn't exist. He trailed off, the implication clear. Thorne scoffed, turning fully to face her, his gaze scathing. Nurse, I appreciate your enthusiasm, but this is a complex vascular procedure, not a first-year anatomy quiz. We're beyond textbook theories. This patient is dying. He gestured helplessly at the monitors. Unless you have a miracle, please step back. As if to punctuate his words, the patient's heart rate spiked erratically, followed by a precipitous drop in blood pressure. Dr. Chen barked orders for more vasopressors. Time was running out, brutally, irrevocably. Elara's eyes, usually downcast, met Thorne's directly. Sir, with all due respect, it's not hypothetical. It's a rare variation, yes, but I've seen diagrams, studied case reports. I believe I can identify it. It's small, deep, but it's there. Her voice, though still quiet, held an unfamiliar steel. The fear was still present, but now it was a cold, sharp blade, not a paralyzing fog. Thorne stared, his expression a mixture of anger, bewilderment, and a flicker of something else. Desperation. He was a drowning man, and Elara, the insignificant rookie, had just offered him a wisp of straw. He glanced at the monitors again, his shoulders slumping further. He had no other options. None. Show me, he finally bit out, the words laced with a profound reluctance, a crushing of his own pride. But if you're wrong, if you cause one more drop of blood to be spilled. His threat hung unfinished, yet perfectly understood. No, sir. Not show you. Elara surprised even herself with the firmness. I need to do it. You operate, sir, with your incredible speed and strength. But this requires a different kind of precision. An almost microscopic touch. She met his gaze, unflinching. If you instruct me, I can guide the catheter. My hands. She held them up, steady, despite the inferno inside her. They are steady. The audacity was breathtaking. Thorne, the great Dr. Aris Thorne, being told by a nurse that she needed to perform his surgery. Nurse Brenda gasped audibly. Dr. Reyes looked as if he might faint. You? Thorne exploded, his face paling with fury. Are you insane? You're a first-year surgical nurse. You've never even held a scalpel in a patient. She's right, Dr. Thorne, Dr. Chen interjected, his voice strained. We're losing her. Every second counts. If there's any chance. He looked at Thorne, pleading. The silence that followed was charged with the weight of Mrs. Albright's rapidly fading life. Thorne looked at Elara, then at the monitors, then back at Elara. Her eyes were alight with an intense, almost frightening focus, all traces of nervousness gone, replaced by a laser-like determination. It was the gaze of a predator, or perhaps, a guardian angel. Fine. Thorne roared, a sound of utter defeat and surrender. But you follow my every instruction, Nurse Vance. My every single instruction. He stepped back, a giant yielding the stage to a mouse. Elara didn't flinch. Yes, sir. Thank you, sir. Her voice was calm, utterly devoid of the fear that had just moments ago consumed her. She moved to the operating table, her movements economical, purposeful. All right, retraction. Deeper, Dr. Reyes. I need a clear view. Her voice was quiet, but it commanded attention. Suction, please, Nurse Brenda. Gently. We need to clear this field completely. She picked up the microforceps, her fingers finding their grip with an innate familiarity that stunned Thorne. Her earlier nervousness was gone, evaporated in the crucible of urgency. Her entire being was transformed. The slight, unassuming nurse vanished, replaced by a being of pure, unadulterated surgical competence. Her eyes, usually demure, were now piercing, scanning the deep, bloodied cavity with an intensity that seemed to peel back layers of tissue, revealing the hidden truths beneath. She wasn't just looking, she was seeing. Seeing the intricate dance of vessels, the subtle variations, the almost invisible tributaries. Light, angle it slightly to the left, please, she murmured, her gaze fixed. Zoom in, Dr. Thorne, on the inferior border of the sternocleidomastoid, deep to the internal jugular. There, do you see it? The faint pulsation. Thorne, now holding the microscopic camera, peered intently. His breath hitched. He did see it. A minuscule, thread-like vessel, almost entirely obscured by surrounding tissue and residual bleeding, pulsating faintly, precisely where Elara had indicated. It was a collateral he'd never encountered in his decades of practice. His mind reeled. How could she know? That's it, Elara breathed, a hint of grim satisfaction in her tone. It's tenuous, but it's there. Nurse Brenda, I need the finest caliber silk suture, 10-0, double-armed. And a microclip. Her hands, so small and unassuming, became instruments of exquisite precision. Under the magnified view, every movement was deliberate, perfect. She navigated the treacherous landscape of Mrs. Albright's internal anatomy with the grace of a dancer. The microforceps moved like an extension of her own will, separating delicate tissues, securing the elusive vessel with a touch so feather-light it seemed to defy physics. Thorne, mesmerized, watched her work. His initial anger had given way to disbelief, then to grudging respect, and now, a dawning awe. He, the celebrated surgeon, was merely a spectator, a glorified assistant to this quiet, unassuming rookie nurse. He found himself holding his breath, leaning closer, completely captivated. The room was utterly silent, save for the hum of machines and Elara's soft, precise instructions. Clamp, she directed, her voice steady. Now, cut. Dr. Thorne, are you ready to repair the primary artery? The temporary diversion is established. We have a window, but it's narrow. He snapped out of his trance. Yes. Yes, I'm ready. He felt like a student, taking orders from a master. He moved to repair the main rupture, his hands, usually so confident, now feeling clumsy by comparison to the ethereal grace he had just witnessed. Elara, having secured the temporary bypass, didn't rest. Her focus remained absolute. She monitored the flow, adjusted the clip with infinitesimal precision, ensuring the new pathway was holding, providing enough blood to vital organs without overloading the delicate collateral. Her encyclopedic knowledge of physiological responses and anatomical variations was on full display. She called out pressure readings, subtle changes in tissue color, anticipated needs before Dr. Chin could even voice them. The minutes stretched into an eternity held together by the quiet competence of Elara Vance. Mrs. Albright's vitals, slowly, miraculously, began to stabilize. The red numbers on the monitor retreated from their precipitous decline. Hope, thin and fragile, began to blossom in the sterile air of War 1. Finally, Thorne completed the repair of the main artery. He looked up, his face glistening with sweat, exhaustion, and an emotion he rarely displayed, humility. "Nurse Vance," he said, his voice raspy, "the repair is complete. The primary artery is secured." Elara nodded, her gaze still fixed on the surgical field. "Excellent, sir. Now, the delicate part. Releasing the collateral and restoring main flow. Gradually, very gradually." Her fingers, still wielding the microforceps, moved with exquisite care, slowly releasing the clip, allowing blood to resume its normal course. She watched, breath held, as the delicate collateral vessel, having served its purpose, was carefully unclipped and allowed to retract naturally, its function no longer needed. A collective sigh swept through the operating room. Mrs. Albright's vitals steadily climbed back to stable levels. The crisis was averted. The impossible had been achieved. Elara straightened up, her shoulders relaxing, the tension slowly bleeding out of her. She took a deep, shuddering breath, her eyes returning to their usual modest gaze, her demeanor softening, as if the master surgeon who had just commanded the room had simply dissolved, leaving behind the quiet, unassuming nurse once more. The silence that followed was different now. It was not despair, but a profound, almost reverent awe. Thorne stared at her, his mouth slightly agape, the weight of his arrogance utterly shattered. Nurse Brenda, Dr. Reyes, Dr. Chen, they all looked at Elara Vance, the rookie nurse who blended into the background, as if seeing her, truly seeing her, for the very first time. The Temple of Medicine, where status dictated respect, had just witnessed a miracle, performed by its most overlooked acolyte. And they were all stunned. And humbled. Elara, however, seemed oblivious to the collective gasp, to the heavy silence that had fallen like a shroud over the usually bustling OR. Her eyes, magnified behind the loupes, remained fixed on the churning crimson battlefield within the patient's abdomen. The emergency was far from over. The severed splenic artery, a major conduit, was now meticulously reapproximated, its ragged edges a testament to the initial trauma and Thorne's desperate, fumbling attempt at repair. But the true test lay in securing the anastomosis and ensuring perfect coaptation without kinking or stenosis, where a single misplaced suture could mean re-rupture and death. Her hands moved with a fluidity that bordered on unnatural. She wasn't simply doing surgery, she was dancing with the instruments. The microforceps seemed an extension of her own fingertips, the needle driver a natural elongation of her will. She called for the 8-0. Proline, her voice a low, steady murmur, devoid of the earlier tremor. Brenda, still frozen, fumbled with the suture pack. It was Dr. Reyes, the senior anesthesiologist, who, with an almost mechanical precision born of years in high-stakes situations, stepped forward and slapped the delicate thread into Elara's waiting hand. Elara didn't acknowledge him. Her focus was absolute, a laser beam concentrated on the almost invisible suture she was weaving through the delicate vascular tissue. Each bite was perfectly spaced, each knot tied with an exquisite economy of motion that left no doubt of its security. It was more than just skill, it was an innate understanding of tissue mechanics, of hydraulic flow, of the very fabric of life. She wasn't thinking, she was knowing. The fine, almost hair-thin needle entered the arterial wall at an exact 90-degree angle, pierced through the intima, media, and adventitia, and exited precisely opposite, creating a perfect cylindrical lumen. Her movements were so minute, yet so impactful, that it was like watching a master artisan repair a priceless, fragile artifact. Thorne, his face pale beneath his scrub cap, found himself leaning closer, his own gloved hand still hovering uselessly over the patient, a ghost of the power they usually wielded. He watched Elara, a woman he had dismissed as a background fixture, perform a repair that would have challenged surgeons with decades more experience than her ostensible rookie status suggested. His mind, usually a fortress of self-adulation, was crumbling brick by brick. He saw the arterial clamp Elara had placed, perfectly angled to control the bleed without compromising distal flow, something he had fumbled with moments before. He saw the smooth, rhythmic pulse now returning to the distal vessel as Elara released the clamp, the repaired artery holding firm, no leak, no seepage. The suture line, perfectly straight and uniform, was a testament to impossible control, a seamless mend where only a moment ago had been a gaping wound. Brenda, who had been Dr. Thorne's loyal first assistant for years, felt a strange lurch in her stomach. She had always prided herself on anticipating Thorne's every need, on being the most competent among the OR nurses. Yet, Elara had stepped into a role that Brenda herself could never have filled, not with that level of surgical grace. The young nurse's movements were so clean, so confident, that Brenda found herself unconsciously mimicking the precise placement of the gauze Elara called for, the gentle suctioning she requested. There was no hesitation, no wasted movement, only relentless, life-saving purpose. Brenda watched Elara's left hand, steady as stone, retracting tissue with just the right amount of tension, while her right hand, deft and precise, navigated the delicate work. It was a symphony of independent yet perfectly coordinated actions. Dr. Chen, the usually stoic general surgeon, adjusted his glasses, his analytical mind struggling to reconcile what his eyes were seeing with what his experience told him was possible. He had seen residents take years to develop even a fraction of this coordination, this intuitive grasp of complex anatomy. Elara wasn't just following protocols, she was creating a solution, adapting to the unique damage with an almost artistic improvisation. When she asked for the fine-tipped bipolar cautery to seal off some errant oozing capillaries that Thorne had missed, her voice was calm, authoritative. Chen watched as she moved the tiny instrument with such delicate precision that it seemed to dance over the tissue, singeing only the target, leaving surrounding healthy structures untouched. His jaw, usually clamped tight, had slightly loosened in disbelief. The monitors, which had screamed a frantic, dying symphony moments ago, now hummed a more reassuring tune. Blood pressure was stabilizing. Heart rate, though still elevated, was no longer plummeting. The patient, teetering on the brink of exsanguination, was pulling back from the precipice. The steady thump-thump of the heart monitor was now a rhythmic affirmation, a heartbeat saved. Elara continued, her brow furrowed in concentration, but without any sign of strain or fear. She wasn't just fixing the artery, she was meticulously inspecting the entire area, ensuring no other hidden injuries. Her hands, usually hidden within utilitarian gloves, were now the focal point of the room. The subtle flex of her wrists, the precise pivot of her fingers as she maneuvered around vital structures, it was a ballet of saving grace. When she spotted a minor tear in the capsule of the spleen itself, a tear that would have eventually led to a delayed hemorrhage, she didn't hesitate. "Surgical glue, please," she murmured, her voice still quiet but imbued with an undeniable authority. This time, the request was met with immediate, unhesitating action. Nurse Brenda, recovering her composure, was already reaching for the fibrin sealant kit. Dr. Reyes adjusted the ventilator settings, his eyes darting from the monitor to Elara, a silent commendation in his gaze. Even Dr. Thorne, stunned into a state of mesmerized submission, found himself instinctively holding the retractors precisely as Elara needed, without a single word of instruction from her. He was no longer the lead surgeon, he was an assistant, and a willing one at that, witnessing a master at work. His muscles ached with the effort of holding still, but he wouldn't dare move an inch, terrified of disrupting the delicate process. The minutes stretched into an eternity, yet simultaneously flew by. Each precise movement Elara made chipped away at the layers of skepticism, professional jealousy, and outright dismissal that had previously defined her presence in the OR. The initial shock had given way to an almost reverent silence. No one spoke, no one dared to interrupt the delicate choreography unfolding before them. The only sounds were the soft whir of the ventilator, the rhythmic beeping of the cardiac monitor, and the almost imperceptible whispers of Elara's breathing. The air in the room, thick with the scent of blood and antiseptic, now vibrated with a different energy, one of profound respect. They had come to St. Jude's to witness the cutting edge of medicine, to be part of a team of world-class surgeons. And they were, but the world-class surgeon wasn't the one they had expected. Elara finally straightened up slightly, her shoulders momentarily relaxing. Pressure holding. Spleen capsule repaired. No further active bleeding. We're stable. Her voice, though still soft, carried an undeniable note of certainty. She removed her loupes, blinking slightly, her gaze sweeping over the now quiet, unmoving figures in the oar. It was only then that she seemed to register their collective presence, their stunned faces, their wide, disbelieving eyes. A faint blush crept up her neck, a fleeting return to her humble, unassuming self. But the hands that had just saved a life remained steady, resolute, still cradling the instruments with an unconscious grace. The patient was stable. The crisis averted. The temple of medicine had been shaken to its very foundations, not by a renowned titan, but by the quiet strength and unseen brilliance of its most overlooked acolyte. The awe in the room was palpable, a heavy, silent testament to the impossible deed Elara Vance had just performed. Thorne looked at the repair, then at Elara, a complex mix of professional admiration, personal humiliation, and dawning comprehension warring in his eyes. The arrogance was gone, replaced by a profound, almost shattering recognition of true genius. He knew, with an absolute certainty that chilled him to the bone, that he had just witnessed something extraordinary. And it had been right there, in plain sight, all along. The heart, previously a frantic, chaotic drumbeat against the silence of the operating theater, now began to find a rhythm. Elara Vance's hands, impossibly steady, moved with an almost ethereal grace, each stitch a whisper of precision, each clamp placed with intuitive understanding. She didn't look up, didn't acknowledge Thorne's stunned gaze, or the palpable shift in the room's atmosphere. Her world had shrunk to the rhythmic hiss of the ventilator, the focused beam of the surgical lights, and the delicate, vital tissue beneath her instruments. She worked methodically, repairing not just the initial rupture, but fortifying the compromised vessel walls that Thorne's team had been so desperate to mend. It wasn't just a repair, it was a re-engineering, an elegant solution that anticipated future stresses. She sealed, reinforced, and revascularized with a fluid, almost instinctive choreography, her encyclopedic knowledge of anatomy manifesting as pure, unadulterated skill. The monitors, which moments ago had shrieked in protest, now began to hum a tune of cautious recovery. The pressure stabilized, the oxygen saturation climbed, and the erratic arrhythmia softened into a regular, if still weak, beat. Dr. Aris Thorne felt a strange coldness spread through him, not of fear, but of profound, humbling clarity. He had prided himself on his surgical instinct, his speed, his precision. Yet, watching Elara, he realized he had been merely competent, while she was a force of nature, a living embodiment of surgical perfection. He saw her adjust a suture with a minuscule twist of her wrist that prevented future stenosis, a detail he might have overlooked in the heat of the moment, despite his years. He watched her choose a specific gauge of thread, perfectly suited to the delicate, friable tissue, a choice that spoke volumes about her understanding of material science and physiological response. He recognized the signature of true mastery, a mastery that transcended training and technique, born from an innate connection to the human form. The other senior staff, who had initially watched with a mix of skepticism and morbid curiosity, were now utterly transfixed. Dr. Lena Hansen, the chief anesthesiologist, who had been on the verge of calling time of death, now leaned forward, her eyes wide as she watched the numbers on her screen steadily improve. A low, reverent murmur escaped her lips. "She's stabilizing him. The pressure's holding." The circulating nurse, Maria, who had seen countless high-stakes surgeries, felt a shiver run down her spine. Elara hadn't asked for a single instrument out of sequence. Every tool was taken, used, and returned in a seamless flow, as if the instruments themselves knew her intentions. There was no hesitation, no wasted movement, only the relentless, unwavering pursuit of life. Elara finally took a small, almost imperceptible breath. The last, critical repair was done. The heart, though still fragile, was beating steadily, strongly. The crisis, the one that had threatened to engulf them all, was contained. She straightened infinitesimally, her gaze still fixed on the surgical field, her expression calm, though a faint flush had risen to her cheeks beneath her mask. The air in or one was thick with an electric silence, broken only by the rhythmic beep of the monitors and the soft hiss of the respirator. Thorne, feeling the weight of the moment, finally stepped back, his gloved hands slowly dropping to his sides. He looked at the surgical field, the intricate, perfect repair, then slowly, deliberately, turned his gaze to Elara. The arrogance was not just gone, it had been incinerated, replaced by a profound awe. His voice, usually booming with authority, was a hushed whisper, barely audible above the machinery. "Nurse Vance," he began, his voice rough with emotion, What did you just do?" Elara finally lifted her eyes, meeting his gaze for the first time. Even now, under the full weight of the spotlight, she remained humble. "I reinforced the ventricular wall, Dr. Thorne, using a modified mattress suture to reduce tension on the primary repair, and addressed the subaortic stenosis that was exacerbated by the initial trauma, which was causing the secondary pressure drop." She spoke with quiet confidence, devoid of any triumph, simply stating facts. Thorne swallowed hard, a lump forming in his throat. Not only had she performed an impossible repair, she had diagnosed and addressed a secondary, critical issue in the heat of the moment, a complication that he, the world-renowned surgeon, had missed entirely. He took another step back, letting the full weight of her explanation sink in. The room was utterly silent, every pair of eyes fixed on them. "Modified mattress suture," Thorne repeated, his voice barely audible. He looked from Elara to the monitors, then back to the patient. "And the subaortic stenosis, you identified it and corrected it while the patient was crashing." He paused, then slowly, deliberately, reached out, placing a hand gently on Elara's shoulder. It was a gesture of respect, of deference, a public acknowledgement of unparalleled skill. The very act of Dr. Aris Thorne, the Titan of St. Jude's, touching a rookie nurse in such a manner sent a ripple of shock through the room. "Dr. Hansen," Thorne said, his voice regaining some of its usual resonance, but now infused with a new, profound humility, confirmed the patient's vitals. "I believe we have a stable field." Lena Hansen, tears welling in her eyes, nodded furiously. "Stable, Aris. Critically stable. BP's holding at 110/70, heart rate 85 and regular. Oxygen saturation, 98%. Her voice cracked with relief and disbelief. Thorne turned to the assembled staff, his gaze sweeping over the wide-eyed residents, the stunned nurses, the incredulous senior doctors. "What you have just witnessed," he announced, his voice clear and resonant, carrying to every corner of the OR, "is not merely an extraordinary surgical intervention. It is a masterclass. A demonstration of insight, precision, and courage that I, in my entire career, have never seen equaled. Nurse Vance has just performed an impossible save." He looked back at Elara, a profound respect etched on his face. "Elara," he said, using her first name, a privilege he rarely extended, "you didn't just save a life today. You saved us." He gestured vaguely at the patient, then at himself, at the entire baffled team. "We were at the precipice. You pulled us back." The words hung in the air, heavy with the weight of his admission, his absolute capitulation to genius. It was the highest praise imaginable, delivered by the most unlikely source. A collective gasp, then a wave of hushed whispers, swept through the operating room. The hierarchy had not just been challenged, it had been shattered, rebuilt in an instant around the quiet, unassuming figure of Elara Vance. The overlooked rookie, the quiet presence, had not only risen but had soared, leaving the established elite stunned and humbled, bathed in the glow of her undeniable, spectacular triumph. The collective gasp that followed Dr. Thorne's pronouncement of genius hung heavy in the sterile air, a palpable shock wave reverberating through operating room 1. Time seemed to distend, each second an eternity as the weight of his words settled upon the stunned assembly. Surgeons, anesthesiologists, and nurses, all pillars of St. Jude's formidable medical elite, stood frozen, their faces a tableau of disbelief, dawning comprehension, and, in some cases, outright mortification. Dr. Thorne, for all his bluster and self-importance, was not a man given to hyperbole, especially not about a junior nurse. His voice, usually a booming instrument of command, had been hushed, almost reverent. This was not praise, it was an admission, a public declaration of an unparalleled skill he had just witnessed, and, by extension, an admission of his own profound oversight. His eyes, usually sharp and critical, now held a strange mix of awe and a nascent, painful self-awareness as he looked at Elara. Elara, meanwhile, felt a hot flush creep up her neck. Her focus, even in that moment of unprecedented praise, remained steadfastly on the patient. The crisis had passed, the danger averted, but the delicate life beneath the drapes was still vulnerable. She meticulously completed the final steps, her hands moving with their characteristic precision, tidying the surgical field, her movements betraying nothing of the internal tremor the word genius had ignited within her. She glanced up only briefly, her usually nervous gaze meeting Dr. Thorne's, a silent question in her modest, brown eyes. Is everything truly stable? Not, did you truly mean that? It was a quiet, almost imperceptible nod from Dr. Thorne that finally released the held breath of the room. The patient is stable, he announced, his voice regaining some of its authority, though a new, unfamiliar strain laced its edges. Vitals are strong. Close her up, Nurse Vance. The command, though routine, now carried a weight of deferral, an unspoken acknowledgement that she had ensured the patient reached this point. Elara, ever the professional, nodded back, her expression one of quiet satisfaction at the successful outcome, not personal triumph. Her humble victory was not in the accolades, but in the life saved. She knew the patient was safe, and that was all that mattered. As the final sutures were placed and the drapes removed, the operating room began to stir. The initial shock morphed into a flurry of activity, but the undercurrent of change was undeniable. The hushed whispers intensified, no longer just speculation but concrete fact. He called her a genius. Did you see her hands? Unbelievable. She saved the patient, saved Thorne's patient. Dr. Thorne himself, usually striding out of the OR with an air of triumphant self-congratulation, lingered. He watched Elara, a complex storm brewing in his eyes. The successful outcome of the surgery was undeniable, a feather in St. Jude's cap, and by extension, his own. But the narrative had irrevocably shifted. The hero of this story was no longer solely him, the world-class surgeon, it was the quiet nurse he had consistently overlooked and dismissed. His arrogance, once his defining characteristic, now felt like a heavy cloak of shame. He was forced to confront the stark reality that his own inflated ego had nearly cost a life, and it was the very person he deemed insignificant who had pulled it back from the brink. The karmic consequence for him began not with an external punishment, but with an internal earthquake, a profound and unwelcome reevaluation of his self-worth and professional judgment. The other senior medical staff, particularly those who had subtly, or not so subtly, patronized Elara, found themselves in an equally uncomfortable spotlight. Dr. Anya Sharma, the sharp-tongued anesthesiologist who had scoffed at Elara's initial, nervous questions, now avoided Elara's gaze. Her practiced indifference had crumbled, replaced by a visible unease. Dr. Ben Carter, the resident surgeon who often made condescending remarks about rookie nerves, shifted his weight from foot to foot, his usual swagger completely absent. They had all been witnesses to Elara's quiet competence, and now, to Thorne's extraordinary praise. Their dismissive attitudes had not only been proven wrong, they had been exposed as arrogant, blind, and frankly, dangerous to patient care. Among the nursing staff, the shift was even more dramatic. Head nurse Margaret, a stern woman who had repeatedly reprimanded Elara for her perceived slowness and lack of confidence, looked like she'd seen a ghost. Her long-held belief in the strict hierarchy, where experience trumped all, had just been spectacularly dismantled. The other senior nurses, who had smirked at Elara's quiet demeanor and whispered about her being too meek for St. Jude's, now exchanged uneasy glances. Their patronizing remarks, their assumptions of Elara's inferiority, echoed in their minds, tainting their own professional reputations. They had judged a book by its cover and, in doing so, had missed the most extraordinary talent in the room. As Elara quietly prepared the patient for transfer to recovery, the silence that followed her was no longer one of dismissive oversight, but one of profound respect. When she finally turned to leave, head nurse Margaret, usually a formidable presence, hesitated. "Nurse Vance," she began, her voice unusually soft, that was an extraordinary display. Thank you. It wasn't an apology, not yet, but it was a crack in the wall of her long-held prejudices, a first acknowledgement of a competence she had refused to see. The power dynamic, once so rigid, had been irrevocably altered by Elara's quiet, undeniable brilliance. The immediate aftermath of the surgery became a crucible for Dr. Thorne. The hospital administration, having been alerted to the critical incident and its improbable resolution, summoned him for a debriefing. He walked in, not with his usual arrogant stride, but with a bowed head, his shoulders heavy. He found himself detailing the events, not as the sole hero, but as the surgeon whose patient had nearly been lost due to unforeseen complications, and whose career had, implicitly, been saved by the extraordinary intervention of his new surgical nurse. And how exactly did Nurse Vance manage to stabilize the patient so quickly, Dr. Thorne asked Dr. Evelyn Reed, the chief of staff, her voice even, but her eyes piercing. Thorne swallowed, the words tasting like ash. She identified the precise point of arterial damage, even before the imaging could fully render it. Her spatial understanding, her knowledge of anatomy under pressure, was unparalleled. She anticipated the next steps, reacted with precision I've rarely seen. It was surgical genius, pure and simple. The admission, once whispered in the heat of the moment, now had to be articulated in the cold light of a formal review. This public, professional validation of Elara's skills, wrenched from his own lips, was the sharpest edge of his karmic consequence. His reputation would forever be linked to this event, not just as the lead surgeon, but as the one saved by his nurse. Word, as always, traveled fast through the labyrinthine corridors of St. Jude's. By the end of the day, the story of Nurse Vance's improbable heroism and Dr. Thorne's humbled admission was already legendary. The whispers among the staff were no longer patronizing, but reverent. The other senior nurses, who had once dismissed Elara, now found their own authority subtly undermined. Junior nurses looked at Elara with a mixture of awe and newfound hope, seeing a path for quiet competence to overcome entrenched hierarchy. The senior medical staff, who had previously ignored her, now paused when she passed, some offering curt nods of acknowledgement, others exchanging uncomfortable, knowing glances. The temple of medicine that was St. Jude's Grand Hospital, once dictated by status and appearance, had just learned a profound lesson. True respect was earned not by title, but by quiet, undeniable skill, especially when a life hung in the balance. Elara Vance, the unassuming rookie, had not just saved a patient, she had subtly, yet fundamentally, reshaped the very landscape of the hospital's elite. The hushed awe that had settled over or one lingered, a palpable residue of a moment that had defied all expectations. Dr. Aris Thorne, his face a canvas of disbelief, humiliation, and a dawning, terrifying understanding, was the first to break the silence, though his words were barely a whisper. Nurse Vance, what did you just do? Elara merely offered a small, almost imperceptible shrug, her gaze still on the now stable patient. I followed the procedure, doctor. Her voice was soft, devoid of triumph, purely factual. It was this understated delivery, after an act of such audacious brilliance, that truly shattered Thorne's composure. He, the man who thrived on grand pronouncements and undeniable authority, was reduced to a bewildered novice by her simple truth. The days and weeks that followed brought a seismic shift within St. Jude's. The initial shock gave way to an uncomfortable reevaluation, then to a grudging admiration, and finally, for many, to profound respect. Dr. Aris Thorne's fall from grace, though not instantaneous or complete, was meticulously orchestrated by the ripple effects of that single, life-saving surgery. His unshakable confidence had been exposed as brittle arrogance. The incident led to a formal review, not just of the emergency situation, but of his general conduct and dismissive attitude towards support staff. While he wasn't immediately stripped of his title, his schedule was altered, his most complex cases reassigned, and a mandatory collaborative leadership training program became a new, humiliating fixture in his diary. His once assured voice in the operating room now carried an underlying tremor of self-doubt, and the cutting edge of his wit was dulled by the knowledge that he had been bested by the very person he had considered invisible. His elite circle, sensing the shift in the wind, began to subtly distance themselves, his once imposing shadow shrinking in the harsh glare of new scrutiny. The other senior medical staff and nurses who had patronized Elara found themselves in an equally unenviable position. Their casual dismissals, the condescending glances, the hushed jokes about the nervous rookie now echoed with an unbearable irony. Some, like nurse manager Davies, approached Elara with awkward, stilted apologies, their eyes avoiding hers, unable to meet the quiet strength that now radiated from her. Others simply changed their behavior, their voices softer, their instructions clearer, their acknowledgments sincere. The hierarchy of Or-One, once carved in stone, began to melt and reform, reshaped by the heat of genuine merit. No longer was a new nurse merely an assistant, they were a potential talent, an unmined resource, to be respected from the outset. For Elara, the external world had changed dramatically, but her internal landscape remained steadfast. The flurry of attention, the sudden deference, the invitations to more specialized training, even the tentative approaches from headhunters at other prestigious institutions, all felt somewhat peripheral. She accepted the new opportunities with the same quiet dignity she had displayed during the crisis, but she never sought them. Her worth had never been contingent on Dr. Thorne's approval, nor on the validation of St. Jude's elite. It was a truth forged in the solitude of her unique past, honed by the countless hours she had spent mastering her craft, driven by a deep, innate desire to heal. Her authentic life was not a sudden ascent to glamour or a dramatic transformation into an outspoken leader. It was a quiet recalibration. She continued to tie her hair back practically, wear her plain scrubs, and blend into the background when not actively engaged in a task. But the slight nervousness that had once clung to her like a shadow was gone, replaced by a calm assurance. The deference she received was acknowledged with a polite nod, but it never fueled an ego. She accepted more complex assignments, not because she craved the spotlight, but because she knew her skills could make a difference. She started to speak up more in pre-op briefings, her observations sharp, her insights invaluable, yet always delivered with a humility that made them easy to receive. One afternoon, after a particularly grueling multi-organ transplant where her precise anticipation of an unexpected complication had once again averted disaster, the chief of surgery, Dr. Anya Sharma, approached her. "Elara," she began, her voice unusually warm, "we'd like to create a new role for you. Surgical liaison nurse. It would involve training junior residents, advising on complex cases, and even assisting in some of our most cutting-edge research. You'd be paid commensurate with your invaluable expertise, of course." Elara listened, her gaze thoughtful. It was an offer that would have been the pinnacle of aspiration for many, a testament to her undeniable brilliance. Yet, she felt no overwhelming surge of pride or ambition. "Thank you, Dr. Sharma," she replied, her voice steady. "It sounds like a fascinating opportunity. But I enjoy the direct patient care. I enjoy being hands-on, assisting where I'm needed most, seeing the immediate impact. Perhaps a modified version, one that still allows me significant time in the OR, on the floor, doing what I do best." Dr. Sharma smiled, a genuine, knowing smile. "Of course, Elara. We'll make it work. Whatever you need." This was Elara Vance, fully stepping into her power. She wasn't rejecting the recognition or the advancement, but she was defining it on her own terms. Her worth wasn't measured by a title or the size of her office, but by the quiet satisfaction of a job expertly done, a life saved, a skill perfectly deployed. She had always known her capabilities, even when others hadn't. The world around her had finally caught up, but her internal compass remained true. She continued to find joy in the meticulous details of her work, in the steady rhythm of the operating room, in the profound privilege of alleviating suffering. Her journey had not transformed her into someone new, but rather allowed the extraordinary person she always was to finally shine, unburdened by the need for external validation, truly and authentically herself. And there you have it, a journey through the unexpected, a reminder that within you lies an incredible wellspring of strength and resilience. This isn't just a story, it's a mirror reflecting the boundless potential we all carry. So, I have to ask you, what unexpected turn taught you the most? What challenge shaped who you are today? I'd love to hear your experiences, your triumphs, and your insights in the comments below. Let's connect, inspire, and learn. Your story could be the spark someone else needs. If this resonated, if it stirred something within your spirit, please follow our channel. Join our community as we explore tales of courage, transformation, and the incredible power of the human spirit. Keep shining brightly.